Let's turn our attention to sending CDSA summaries within the ACE application. Before CDSA summaries can be sent, the user must determine if any CDSA summaries are missing and not yet completed. This check is done by means of a patient report. To locate the report, navigate to the patient section of the ACE application and click on the Patient Reports button. Once the patient reports loads, select the report called All Patients CDSA Summaries Missing report. Select All Therapists, enter the appropriate date range, and click the Run Report button. The report will load. It will be sorted by CDSA, then by therapist, with all applicable patients indicated below. The administrative user will then need to communicate with the clinician to determine why the CDSA summary is not completed and when it will be completed. Additionally, a user may choose to run the same report in Excel. The Excel report of missing CDSA summaries will allow the user to copy and paste patient names should they wish to email the clinician regarding missing summaries. Once all CDSA summaries have been accounted for, they may be sent to the individual CDSA agencies. This action is performed by means of a patient report. Navigate to the Patient section of ACE and click the button for Patient Reports. Next, locate the report called All Patients CDSA Summaries. Use the Shift and Down arrow on the keyboard to highlight and group all offices for an agency together. Enter the appropriate date range and click Run Report. CDSA summaries will appear and may be reviewed as needed. Keep in mind that it may take some time for the CDSA summaries to load since the program is pulling them from each patient's EMR. Summaries are grouped by clinician and then appear in alphabetical order by patient last name. The user may then determine the method that's best to share the CDSA summaries. They may be faxed, emailed with a password, saved, or printed. Some CDSA agencies will accept a patient's progress notes in lieu of a CDSA summary. The Winston-Salem CDSA is one of those agencies. In order to pull all progress notes for a Winston-Salem CDSA agency, the user will need to locate the All Patients CDSA Progress Notes Winston-Salem report. This report may take up to 10 minutes to run since the program is accessing so many different EMR documents and sorting them appropriately. Be patient. The large PDF file will appear. The user should choose the Save Disk icon to save the EMR documents. The document should be encrypted appropriately with a password to be emailed. Larger files may need to be sent in separate batches, depending on the manner in which they are sent. Discharged patients are the final step in the workflow. Accept the message regarding the discharge from your work group. Depending upon which work group you are in, you will have a different task associated with the alert that you should already be familiar with. The message goes to the administrative group as well as the billing group. When a discharge summary is signed, the patient status will automatically be changed to discharge pending, and the clinical discharge date will be added to the program. Administratively, an employee will review the discharge summary to indicate the reason for the discharge. This information is important because it helps on a company level to track how many patients are discharged within normal limits versus being discharged for other reasons. Proceed with your normal workflow to financially discharge the patient. Enter a billing discharge date once the patient is financially discharged and change the patient status to discharged patient. This concludes the instructions related to CDSA summaries in the administrative portal of ACE. For further information, feel free to watch the video again and pause as necessary. Additionally, you may consult the written Administrative ACE Manual for detailed instructions and screenshots related to specific features and tasks.